What is acoustic neuroma? Acoustic neuroma, also called vestibular schwannoma, is a benign tumor that develops on the vestibulocochlear nerve that passes from the inner ear to the brain. The tumor originates when Schwann cells that form the insulating myelin sheath on the nerve malfunction. Normally, Schwann cells function beneficially to protect the nerves which transmit balance and sound information to the brain. However, sometimes a mutation in the tumor suppressor gene, NF2, located on chromosome 22, results in abnormal production of the cell protein named myelin, and Schwann cells multiply to form a tumor. A 34-year-old man is evaluated in the clinic due to persistent buzzing in his right ear for the past 6 months. The patient also has decreased hearing on the right side. He has had no fever, ear pain, runny nose, sore throat, or cough. The patient does not use cotton swabs and has not been exposed to loud noise. He tried using over-the-counter oral pseudoephedrine with no improvement in his symptoms. On physical examination, there is no sinus tenderness, and mucous membranes are moist without erythema or exudate. Otoscopic examination reveals normal-appearing external auditory canals bilaterally with pinkish-gray tympanic membranes. MRI of the brain reveals an intracranial tumor. This patient's lesion has most likely arisen from which of the following structures? The correct answer is D, vestibulocochlear nerve, cranial nerve VIII. This patient's clinical presentation is suggestive of acoustic neuroma, a Schwann cell-derived tumor that typically arises from the vestibular portion of the vestibulocochlear nerve, cranial nerve VIII. The vestibulocochlear nerve exits the brainstem from the pontomedullary junction, lateral to the facial nerve, and enters the cerebellopontine angle, between the cerebellum and lateral pons. Patients with acoustic neuroma usually have ipsilateral sensorineural hearing loss and tinnitus, ear ringing buzzing, due to impairment of the cochlear portion of the nerve. Damage to the vestibular component may also result in vertigo, dysequilibrium, and nystagmus. Most cases present unilaterally, but bilateral acoustic neuromas are frequently seen in patients with neurofibromatosis type 2. Choice A. The trigeminal nerve, cranial nerve 5, exits the brainstem from the ventrolateral pons. Injury to cranial nerve 5 may cause ipsilateral loss of facial sensation and a corneal reflex, afferent limb, and paralysis of the muscles of mastication. Choice B. The abducens nerve, cranial nerve 6, exits the brainstem from the pontomedullary junction medial to the facial nerve. Injury to cranial nerve 6 may result in the inability to abduct the ipsilateral eye and horizontal diplopia, lack of innervation to the lateral rectus. Choice C. The facial nerve, cranial nerve 7, exits the brainstem from the ventrolateral pontomedullary junction, just lateral to the abducens nerve. Damage to cranial nerve 7 may result in ipsilateral facial muscle paralysis, upper and lower, loss of the corneal reflex, efferent limb, loss of taste in the anterior 2/3 of the tongue, and hyperacusis, lack of innervation to the stapedius. Choice E. The glossopharyngeal nerve, cranial nerve 9, exits the brainstem from the postolivary sulcus in the medulla just rostral to the vagus nerve. Injury to cranial nerve 9 may result in loss of taste and sensation in the posterior 1/3 of the tongue and absent gag reflex, afferent limb. Choice F. The vagus nerve, cranial nerve 10, exits the brainstem from the postolivary sulcus, just caudal to the glossopharyngeal nerve. Damage to cranial nerve 10 may cause dysphonia, lack of innervation to the laryngeal muscles, impaired swallowing with inability to elevate the soft palate, lack of innervation to the pharyngeal muscles, and loss of the gag reflex, efferent limb. Educational objective. Acoustic neuromas are Schwann cell-derived tumors that typically arise from the vestibular portion of the vestibulocochlear nerve and are commonly located at the cerebellopontine angle, between the cerebellum and lateral pons. Patients usually present with unilateral sensorineural hearing loss and tinnitus.